I had a visit this morning at a daycare. I worked there to help a few kids, and I felt like the educators were exhausted, and it's understandable because they spent the whole year with this group with many children with special needs in their group, but mostly that now they have the transition from the old groups to the new groups. The kids are changing classes, they are receiving new kids, so there's a lot happening, and the educators are asking more and more for one-on-one interventions, that I work with a child one-on-one at the daycare. And I'd like to share with you a little bit my vision about that. And I think that, yes, okay, one-on-one is good, but what's more important is that I coach or I guide the educators in how they can apply the strategies I recommend in the classroom, and mostly that we choose the goals that we would like to work on together. Now, considering that it's the end of the school year and that these educators are going to change in a few weeks, I did end up doing a little bit more one-on-one with these kids. But for August, September, with the new educators, I highly recommend that any intervention that is done in speech therapy at a daycare be at least divided between, yes, one-on-one intervention maybe to implement, let's say, new sentence structure or to teach the child something specific, but it has to be quickly reinvested in the classroom setting, because if the child learns that I can use this sentence structure, let's say, with this game, the child has to be able to transfer that knowledge to everyday life, that this is what I have to say when I want to socialize. So yes, maybe functionally it's easier for the educator to kind of hand us the kid and, take him, do your magic, fix the child and bring him back. But that's not representative of the rest of the week, what the child's going to live and the situations the child is going to have to face. So the ideal situation would be to work with the child in the group to kind of, see what is the cause of the conflicts between the kids and that child. What causes the child to have communication breaks or difficulties in either understanding or expressing, and what can we do functionally in the classroom to help this child. So this is my vision when it comes to daycare settings, but it's not always easy to have the educator on our side, and this is really something I'd like to work on in the next school year.